We're here today because of the fantastic launch of the research bus, and for us it means it's a great opportunity for us to take our research out of the hospital area, out of the trust, and actually reach out to our communities, work with our communities, involve them in research, people who would not normally come and access a research study. Going out, talking to them, but also involving them in the research and actually getting ideas from them, what's important to them about their healthcare, what's important so that we can actually start looking at prioritising research to engage with them.
We have a huge diverse population. It's not always easy to access a clinic for research. People also feel quite traditionally unsure, uncertain about research. So the bus is going to enable us to go out to those community settings. Maybe it might be a car park, it may be a primary care setting, it might even be a supermarket or a community group, to enable people to understand and engage and ask questions. So it's really about taking the research to them, about supporting that patient-centred care model.
I think it's welcoming, I think it's inclusive, and I think it gives the right message. Inside, it's equipped, there's a waiting area and there's a clinical area, for example, to take blood and then to spin the blood depending what we need to do.
So research is really important for driving improvement in clinical services, and we can only do that if everybody's engaged and everybody's involved. And now as clinicians are training, all sorts of clinicians are involved in research. So from an academic perspective, it's really important for our students to see research and see the different ways that we can do research. Research doesn't just happen in hospitals, it can happen all over.
To actually engage with communities, for communities to understand what our priorities are as an organisation. We're interested in the health and well-being not only of people who use our services, but the population we serve. And if we can influence in any way them being involved in research, but also telling us what some of their priorities for research would be, that can help us to prioritise better how we meet their needs.
The National Institute of Health Research have funded the buses. There was a call out a couple of years ago where we put a bid in to be able to gain funding and obtain funding. Not only that, their local research regional delivery network, we work in partnership with them. They work with us looking at how we can engage with communities. We've got a really great partnership with them, and so a huge thank you to them for supporting us with this endeavour.
I could envisage using the bus, for example, to go in and talk to people who've got newly diagnosed arthritis, who want to take part in research studies, who might want to do things like tell us about their experiences, how we could shape our clinical services. People might want to get involved in studies about their risk of developing arthritis. They might be healthy. We get involved in studies where family members are asked to get involved in research. So if your parents have got a particular condition, are you more likely to get involved in that? Now, those healthy people might not want to come to hospital, but they might be happy to come and take part in a research study done in a way like this.
It just feels like a great resource, eye-catching as well, because what I like is we've worked with the community to actually shape the design. That's been influenced by schools, young people, the communities that we serve. It's for the people that we serve, so it's perfect.
We've got to be prepared to research at a formal level, to challenge the status quo, to be thinking about alternatives to doing things. What we are doing now will be different to what we will be doing in 2 years' time. That's down to research and development. People who are going into hospital now will be cared for in the community into the future and cared for very safely. How? Why? Because of initiatives such as this bus, the research and development we're involved in. It's about challenging the way we do things around here.